Hey there, I'm Mr. Terry, a high school history teacher. Welcome back to another History Teacher Reacts video. All right, I found an opportunity to return to Dr. Mike's channel. Now, Dr. Mike is a massive YouTuber. He's a doctor that covers medical stuff. And there's been a couple times where he's talked about history, specifically relating to the medical field. And just a little while ago, he posted a video about old treatments that doctors used to give. Now, I think medical history is really fascinating when you look at older civilizations and the things that they used to do. And of course, what you find with them are some brilliant practices, especially for their day. But then also you see stuff, you're like, what were they thinking? So that's what I'm hoping to check out from this video. And then of course, I definitely want to chime in with anything that seems relevant to what he's saying. All right, the original video is down below. Make sure you're supporting that. Let's get started.
Treating syphilis with malaria, blowing tobacco smoke up your butt. Buckle up, folks. This isn't science fiction. These are real treatments, real patients used throughout history. Thank God modern medicine has come a long way. Oh, and I'll also tell you about a medical treatment we use right now that I think might be on its way out in the near future. Let's get started.
You know what? That's what I was just thinking as he was saying the intro there is like, what do you think in the future doctors and things and society in general are going to say that like what we were doing in 2023 that was just ridiculous? What do you think? Let me know down below. All right, let's see this.
Doctors used to recommend lobotomies to treat mental health problems. And a lobotomy literally means tearing apart your brain. Feeling depressed, anxious, or simply have a nagging headache? Have you considered removing part of your brain? Well, many have for all of human history. Lobotomies are one of the oldest verified medical procedures historians know about, thanks to the remains of humans from thousands of years ago that present clear evidence of rudimentary surgeries in the skull.
So again, I'm not a doctor. I just study history, but the brain is one of the most complicated and least understood parts of our body. And it kind of makes sense, especially in ancient times, that people, you know, depending on their cultural beliefs or whatever, and thinking how the brain operated, probably had, you know, a lot of different varying ideas about how the brain functions and like how you can actually like interact with that. So like, again, the idea of going into somebody's brain and removing or manipulating parts of the brain, because different cultures might think that different parts of the brain control different things. That kind of makes sense. But like modern lobotomies, I'd have to learn more about why they have done those so recently in history. I give a pass mostly to all the ancient folks, but like as modern as it's happening in like the 20th century, I need to learn more about that.
The earliest days of civilization, seemingly across the globe, the medical thinking was that if you had a problem in your head, the head needed to be opened up. This practice reached its apex in the US in the 1900s when lobotomies were regularly performed. Today, neurosurgery and lobotomizing small parts of a patient's brain are still used in highly specific cases.
Let me read this. Some types of psychosurgeries are performed in very rare circumstances to treat conditions such as severe depression or OCD that don't respond to other treatments. Okay, so there is still some parts that are understood. I guess I asked this before. They're doing it, but I can't imagine it's the same way though that they did it before. Like now we have a pretty good understanding about what parts of the brain operate, which parts of our personalities or whatever. So yeah.
But the simple method of cut out the frontal lobe of a crazy person approach is no more. And it's considered one of the more shameful eras of worldwide medical history.
So the last thing I wanted to say about this though is, here's my question then. So lobotomies again are ancient, right? We've done this for thousands of years. And you would think that with them having been performed for so long, that they must have had a desired effect. Otherwise, why would it be such a popular thing for so long? Like it actually achieves the effect. So I'm wondering if they really did think there was some truth to it, that it did get the desired outcomes. However, are those desired outcomes a result of whatever it is that you were doing in that changing of brain structure and stuff like that? That's so weird, huh?
Doctors used to recommend cannibalism to treat everything. Throughout a large chunk of human history, doctors in Europe regularly prescribed corpse medicine, or the practice of consuming the remains of dead people for medicinal benefit. The problem? There was no medicinal benefit.
Hey, I was just saying, is this just like a medieval version of like a blood transfusion, where they're like, hey, we got to use this person's blood, superior blood or something like that, inject in your nose, but like the flesh and all that? I guess, I mean, there are other cultures where you could consume sometimes like the enemy's flesh A story that came to my mind just now was like with the Aztecs. So they used to, you know, very well known for doing human sacrifices and that. And one of the processes, part of that is, you know, finding like a very like brave and notable person on the enemy side, and like they used to like wear their flesh and consume the flesh, like whoever kills that person, to do that, like they would consume that because felt it had some kind of property that way. But yeah, there's some historical context.
The thinking was that if you had a problem in your head, you would eat the ground up remains of someone's head. You see, this is why we don't put much stock into treatments that make sense or experts believe in unless they're proven with evidence.
Exactly.
Obviously, no such evidence that this barbaric practice ever worked existed, but that didn't stop apothecaries from 16th and 17th century Europe from turning a profit selling blood marmalades.
Here's the thing though, maybe it's you know, historically speaking, it gives you confidence. Like if you consume the flesh or the blood of a great enemy warrior, maybe that gives you confidence. So it does have like some kind of effect, or it has social value, right? Like you are the one known for killing this person. Yeah, you consume their stuff, but like people are going to treat you differently, which then in turn gives you confidence historically, you know.
Consider it the goop of the Renaissance. It goes without saying, consuming the remains of Egyptian mummies or slain Roman gladiators does not cure any illness. And in fact, it comes with the extremely high risk of poisoning from eating decayed, infected flesh.
Did you know that they used to sell gladiator sweat? It was seen as an aphrodisiac.
Milk is a lot like blood, right? Blood transfusions are a life-saving procedure often performed on patients who have suffered serious trauma. But throughout most of human history, doctors didn't just have a fridge full of blood to run to in emergencies. In the late 19th century, some doctors believed milk was a substitute for blood because it contained many nutrients and that the milk would eventually turn into white blood cells to help fight off an infection.
Another
white blood cells.
Human juice.
See how they got there. Obviously, this didn't work.
Milk has different types of bacterias and stuff too that are unique to milk, so I can't assume that would be a very healthy thing. I don't know of any historical context of it though. Let me know if you know.
Didn't stop doctors from trying. In one well-documented and frankly unbelievable case, Dr. Joseph Howe treated a sick woman with what he believed was a groundbreaking idea. Not cow's milk, he said, but human milk. A woman in the hospital actually donated 3 ounces of breast milk, which was intravenously injected into the sick woman's veins. Needless to say, the results weren't just ineffective, but actually negative, causing the patient's heart rate to spike while she convulsed in pain. Dr. Howe managed to stabilize the woman by injecting her with morphine and whiskey. To no surprise, she unfortunately died 10 days later.
You know where you see a lot of these things historically is when everything like traditionally that you've used to treat something has failed and you feel like you have nothing to lose. You know what I mean? And that can be very positive, and it has been very positive for the history of medicine. So like, you know, the first heart transplant, okay, that happened in the 20th century, late 20th century or mid to late 20th century, whatever. Like, you know, obviously they're going to do the things they know to treat the heart first, and those fail, right? I think it was, where was it? Like South Africa or whatever. I can't remember where they did the first successful heart transplant. But like, you know, obviously you're going to try to do all the conventional methods. And then when you're out of options and, you know, that person's going to die, you've got nothing to lose but to try something that seems really radical. And maybe the milk thing, I would hope that was a last resort kind of thing.
Doctors used to prescribe the mosquito-borne illness malaria to treat another disease, syphilis. I realize that's
actually transmitted disease.
But what's even weirder is it actually worked. Syphilis is a bacterial infection spread through sexual contact. Prior to the widespread use of condoms and the invention of antibiotics, the disease was rampant across the globe, suspected to have infected some highly notable figures like Al Capone and Adolf Hitler. Untreated syphilis in its late stage spreads to organs, destroying them from within, leading to potential disfigurement or even death. One way your body fights off infection is by giving you a fever, which creates an environment too warm for invading bacteria to survive, and one in which your immune system thrives in. Why malaria? Well, it's caused by a parasite in mosquitoes that causes extremely high fevers, and we actually had a treatment for malaria. So in the early 1900s, Dr. Julius...
Fevers are a response to something already going in your body. It's your body reacting to that. So I guess that would kind of make sense. that the malaria, the fevers come from it, could I guess attack a different problem, but at the same time you're also dealing with malaria. Malaria has been historically one of the biggest world killers. It has spread continentally. Syphilis too, right? So sexually transmitted diseases, especially ramping up in say like age of exploration and conquest. Something's famous, that a lot of Europeans brought back to Europe were sexually transmitted diseases. But anyway, yeah, malaria has been one of those. Malaria, one of the biggest outbreaks, recently too, was when they were doing the Panama Canal. That had a huge outbreak because those insects and stuff that can transfer that were in those areas by the canal in Central America. That was a massive killer, one of the biggest killers again that we've had in world history.
Wagner Jauregg had an idea. Give his patients who were sick with syphilis, the parasite that causes malaria, allow the fever to spike, kill the syphilis, and then use the medicine that already existed to treat the malaria. It was a bold idea that actually worked, netting Dr. Wagner Jauregg the Nobel Prize in Physiology and Medicine in 1927. Malariotherapy was used all around the world for the next couple of decades until the invention of penicillin, which is an antibiotic that kills syphilis without having to resort to getting people sick with other illnesses.
Penicillin's probably the greatest, historically speaking, the greatest medical invention ever. Antibiotic, right? Because they didn't have antibiotics before then, so it was like impossible to like treat the causes of things. You just like treated the symptoms, and penicillin, enormous. But unfortunately fairly recent.
Doctors used to recommend heroin to treat the common cold. During the American Civil War, the drug of choice to treat soldiers suffering traumatic injuries was morphine, a highly effective and addictive drug derived from opium poppies, or an opioid. It interacted with pain receptors in the brain to virtually eliminate pain sensation in the body and leave patients in a dreamlike euphoric state. While highly effective, it also resulted in thousands of soldiers becoming addicted to the substance. In response, Bayer, the pharmaceutical company, began boiling the morphine in an attempt to reduce the drug's addictiveness, and thus heroin was born. Unfortunately, boiling morphine doesn't make the drug less addictive.
Correct.
In fact, it makes it more addictive.
Heroin's one of the most addictive substances ever.
And capable of being mixed with other additives, leading to far more extreme reactions in the body. This didn't stop the medical establishment, and in 1906, the AMA officially approved heroin for general use. Doctors not only recommended heroin for extreme pain, but for more common conditions like bronchitis, tuberculosis, cancer, depression, sluggishness, the common cold, old age, or even a simple cough.
It seems like, just going back to the list they're doing here.
The common cold, old age, or even a simple cough.
It almost seems sketchy to think that the treatment, a medicine, whatever it is, could affect so many different things. That seems like a red flag to me. To have so many very, very varied, right, type of afflictions or whatever, like that's got to be kind of sketchy because it's got to have side effects. You know what I mean?
For adults and children alike. The real impact of heroin became obvious soon enough as addiction and crime rates soared, leading to federal regulation of the drug and the AMA revising their previous recommendation. Today, opioids are still prescribed. However, many measures have been enacted in hopes to bring down the soaring rates of addiction and overdosing. Cure your rheumatoid arthritis by staying inside the body of a dead whale, something I never thought I'd say on this channel.
Why?
Look, this wasn't a practice that was endorsed by doctors, but it was publicized in papers as something people actually did. The way the story goes is that a drunk Australian man suffering from joint pain dove inside the body of a dead whale laying on the shore of Eden, New South Wales in the late 1800s. The man was a...
Did you see him sticking out? You know what this reminded me of? Yeah, you can see him in there. I was thinking of like Luke Skywalker getting in the Tauntaun when it was too cold. I mean, hey, that works. I guess that's like a medical solution.
Is that a drunk Australian man suffering from joint pain dove inside the body of a dead whale laying on the shore of Eden, New South Wales in the late 1800s. The man was a bit of a jokester and was trying to make his friends laugh. Disgusted by the smell and the idea of touching a dead whale, his friends didn't rush to his aid and left him on his own for escape. And upon leaving the whale, he claimed it cured his joint pain. The theory was that the fumes of the rotting whale created an aerosolized treatment for his joint pain. Advertisements literally popped up for whale hotels where those suffering from rheumatism could stay while they waited for a deceased whale to arrive on shore. If you could survive 30 hours inside the dead whale, your joint pain could be alleviated for up to a year. Kind of sounds like those oasis disease curing retreats that make ridiculous claims about their resorts. This one had a whale spin to it, if you know what I mean.
Hey, I've had back problems for about 20 years now. I've had 2 back surgeries. Hey, if something like that will cure me forever, maybe I'll jump inside that blowhole.
Of course, look, I can't believe I have to say this, but there's no evidence that breathing decaying whale air for 30 hours alleviates anything, let alone joint pain. How about blowing some smoke up your butt to save someone from drowning? Native Americans regularly used tobacco as a form of medicine, something the Europeans noticed and took back home. The idea of blowing tobacco smoke into someone's rectum became the go-to method of saving a drowning victim in England. The theory was that someone who had nearly drowned was cold and wet both inside and outside of their body, so that if you blew tobacco smoke up someone's butt, they would be warmed and dried out from the inside, bringing them back to life. Quickly, this
Hey, you feeling cold? You feeling cold? Here, take this Cuban cigar I've got.
This expanded beyond drowning victims, with doctors across Europe believing it was effective at treating all sorts of things, from headaches to hernias to cholera. The practice was not only useless to patients, but sometimes even dangerous for doctors. Before the invention of bellows, or the contracting, expanding device that sucks and blows air, doctors had to blow themselves. And in the event that a doctor...
Was there actually an old picture of that made by somebody?
Doctors had to blow...
Some old medical journals? Did it have to be smoke? Or sorry, tobacco smoke? Like, is the butt gonna be addicted now?
Themselves. And in the event that a doctor accidentally sucked instead of blew, they would inhale a mouthful of contents from the inside of the patient's rectum, which actually led to infection and death of some doctors.
Who wants that job?
Doctors used to recommend smoking tobacco as a treatment for asthma.
Okay.
Yes, actually recommended. The historical thinking was that asthma and other respiratory illnesses were caused by an accumulation of cold phlegm in the lungs. And the best form of treatment for this cold phlegm was the inhalation of warm smoke from burning tobacco or stramonium.
Yeah, that's not how asthma
William
works.
Osler, the Regius Professor of Medicine at Oxford University, went as far as encouraging asthmatics to sample a variety of cigarettes. It didn't stop there though, as Dr. Osler also encouraged asthmatics to fill their bedrooms with smoke prior to sleeping to ward off a nighttime asthma attack. While asthma can be treated by medicine consumed from an inhaler, inhaling tobacco smoke would have the opposite effect. Kids whose parents smoke have higher rates of asthma attacks and are more likely to end up in the hospital. That's because smoke from cigarettes makes airways swollen and narrow, essentially doubling down on the problem asthmatics are already facing. Doctors used to recommend draining your body of fluids to treat literally everything. The practice was known...
Bloodletting. I mean, he's probably gonna say bloodletting. That was really popular during the plague. Bloodletting, thought your blood was cursed and all that kind of stuff. But yeah, you would let it out. And the problem with that, as you can imagine, means those, the germs, virus, all that kind of stuff that's going to be in your blood if you're doing bloodletting, that's now going to be exposing to other people. And in a lot of cases in the, the Black Death, the treatments actually increase the spread of the disease.
As balancing the humors. For thousands of years dating back to Hippocrates in ancient Greece, the medical establishment believed that all illnesses were caused by an imbalance of the humors: blood, phlegm, black and yellow bile. Doctors believed that a healthy person had a perfect balance of all four, and that in order to cure a sick person, you simply had to rebalance them. The method by which they would achieve this balance was sickening and painful. Doctors would cover you in blood-sucking leeches, induce vomiting or diarrhea, or burn burn you to create pus-dripping sores across your body.
Not just cut
but what
you.
they failed to realize is that many of these instances, it was the diseases that imbalanced these humors, not the imbalanced humors creating the disease. Look, obviously putting an already sick person.
You can tell like so many of these things are pre-scientific method, right? That's why when scientific method coming from the scientific revolution, like how the medical field and scientific field just in general though just skyrocketed by actually having a testable, accurate method to be able to actually like find the problems and not just things that like correlate with them. You know what I mean?
And through a circus of blood, sweat, and tears did not improve health outcomes and actually usually led to the death of those patients. Most notably, President George Washington, who was killed by his doctors while attempting to balance his humors.
By the way, he just was
who was killed.
Yeah, commenting or was pointing to this video on the right. This was the only other Dr. Mike video I've covered. And this was really good. I thought this was really good. It was fun to learn and to be able to add to this one. So yeah, medical look into what killed every president. And there were some weird ones too. Check that out. I'll make sure to link it. It'll be at the end of the video, you know, when around the video, you know, around the screen, new thumbnails come up. That'll be here for sure. It'll probably be right up over here at the end of the video. So yeah, check that out, especially if you like Dr. Mike and medical history.
By his doctors while attempting to balance his humors. Army doctors around the world used to recommend methamphetamine to create super soldiers.
That was another one of those.
Was popularized worldwide during the Second World War when military doctors started recommending soldiers take the drug to keep them alert, awake, and energized. American soldiers took the drug to stay awake on the front line. German soldiers took the drug to blitzkrieg countries like Poland in record time.
I was gonna say the German one. They use that a lot, and how those guys could, you know, and anyone, and not just obviously the Germans, but how they could just like work at incredible rates, right? Because I mean, think about like trench warfare, you know, something like that, where you are completely exhausted, you're underfed, right? You're going through all kind of psychological distress. That kind of stuff would have a huge impact. But like you were saying before with morphine addicts, that they're also a lot of these, you know, former soldiers, they're going to come home drug addicts, right? And almost everybody came back from these wars addicted to something. If it wasn't like morphine or meth, it was definitely like tobacco, because a lot of people picked up smoking then, especially, you know, in wars where it was so defeatist that you thought you were going to die anyways. And smoking, you know, tobacco could give you some kind of relief at a time where you think you're going to die anyways.
Japanese soldiers took the drug before hopping in planes as kamikaze pilots. Yeah. Soldiers became addicted to the stuff, and companies started mass producing it worldwide. Of course, the war came to an end, and all of a sudden, military warehouses had stockpiles of surplus meth. It was then distributed nationwide by physicians who recommended for a variety of conditions, like weight loss. Abuse of the drug eventually led to its regulation thanks to the Controlled Substances Act of 1970. Interestingly, meth is still prescribed by doctors in the US today under the name of Desoxin. It is only used with very specific diagnoses like ADHD. But what about the medical practices of today? Well, we have certainly come a long way since blowing smoke up your butt. I believe there are probably some medical practices we do today. They're going to be looked upon and really judged heavily in the future.
Yeah, what do you think about this?
I think are colonoscopies. Don't get me wrong and hear me out here.
Okay.
Colonoscopies work in catching colon cancer
very
early.
Important.
In fact, preventing some cases of colon cancer by removing polyps before they turn into cancer. But the practice of having to stick a camera into someone's colon through their anus is going to be looked at rudimentary. At least I think so. I think there's going to be new technology that's going to allow us to either chemically detect, and there's already some early stages of this, colon cancer, or maybe even ways to enter the body without having to go in through the rectum. That's just my take. Which one of the medical practices you think today are going to be judged heavily in the future? Comment down below. And look, these were some cringy medical practices, but how about some horrifying medical devices physicians actually used to use? Click here to check these out. As always, stay happy and healthy.
Before I leave, I do have one more comment to make and my conclusion. Stick around. If you like this video, this one, I've never heard of this one. Doctors react to horrifying old medical devices. That seems, like historical, up kind of the alley of what I cover. If that's something you'd like me to see, let me know down in the comments for sure, or post the video link just so I can know over on the Discord server in the video suggestions. I was gonna say though, before he was just saying about like colonoscopies going away. I feel like that's different though, because like that's just like finding a more efficient method to do something we already know works. But like where I'm interested more in learning about and like getting feedback is like, what are we doing wrong like right now? Like it's not wrong to go and do the colonoscopy the way it is because that's the best we have with the technology. But like, what are traditional things we're doing now that could be seen like we were doing this way wrong for a treatment of something? Let me know down below. All right, final thoughts. Don't go anywhere. All right, that was fun and very interesting to check out. I know I learned a bunch of things. Hopefully I was able to put in some relevant context to some of these treatments and like where they were used and when they were used historically, and help you put that together, because that's what I love to do and that's what I do on my channel. But anyways, yeah, so like I was saying, let me know down below if you think, what are some things we're going to be looking at in the future, looking back at our time, that we're going to, think we were stupid for doing, because we got to be able to think of something there. And if you want me to check out more of this kind of stuff, do commentary and reaction, of course, let me know. Again, video links down below. Make sure you're supporting Dr. Mike's channel with what he did there. Give it a view, like, subscribe if you like what they're doing there. And if you like what we're doing over here, love to have you around in our community and see your face a little bit more. So view, like, subscribe. Awesome. If not, hope I see you again soon. All right. Bye.